on Coleman. Count on Coleman. If your world is looking strange, you can count on Coleman for change.
Hello, Baton Rouge, and especially District 10, the best district that I know. But today I am welcoming all districts here at the Coleman Cares podcast, where we do our level best to educate the people. That's the purpose of the podcast, education. And so I have a gentleman here with me today, the #1 senator from District 14, none other than the Honorable Larry Selders. So you may as well give it up for him. And so with that being said, I'm just elated, appreciative to have you to come and share you with them. Yes, it is very important that folk know who you are and know what you do, know where you've come from, know where you're going, and then they'll know what to do. And so take it away.
Absolutely. I really appreciate you inviting me to the show, and I love the media center you've created here. And
thank you. Yes,
giving folks like me a platform to so folks can continue to get to know me. I served in the legislature for 5 years before I became a senator. But on top of that, I'm married. My wife, Dr. Kendra Michael Selders, she's a pediatrician here in Baton Rouge. We have 2 lovely boys. Luke, he's 10, and we have LJ, Larry Jr., he's 12. So that's who I am.
That's who you are.
I am.
Yes.
I'm a husband and a father.
That's it.
And I'm a public servant.
And if you ain't that, if you not that, family first, and then we do this other stuff. And so today we are here for you to be able to discuss the recent election, what your upcoming plans are. And I say recent, but you've been in this seat here, so just talk about and what your upcoming plans are. And many know your work. Many know your work in politics. So just take it away. Tell them who you are, what you do, what you stand for, all of that good stuff.
No problem. Born and raised here in Baton Rouge. Was born right down the street on Buchanan Street. Right here in South Baton Rouge.
District 10.
In District 10.
There you go.
Yeah. And I just love what I do. I've never even dreamt to be a senator. I never, it's not my plan. It's never my timing. But I had the opportunity, and I was blessed to have the opportunity to serve. Happened Congressman Fields, became a congressman, and the seat came up, and I ran for it, and saw the opportunity. I ran for it, and we won. I do a lot of stuff with mental health. My degree's in social work, so a lot of my bills are just centered around mental health and access to care for folks that's underserved.
Yes.
I've had bills to deal with mental health in prisons. I've had bills to do with mental health in schools. I've had bills to deal with just transparency and utility bills, dealing with permitting, for underserved folks in the community that I grew up in, and issues that I've seen. But it's just, I've had sex victim reparation funds for victims of domestic violence and sex crimes. We've done a lot of work, to advocate for the people. And my motto is for the people, not the politics, and it's going to continue to be that since I started. And, so people don't realize that I probably lived in every neighborhood in Baton Rouge. My mama was a renter.
Yes.
And so we lived in Easy Town. My mom went to Capitol. We lived in Dixie. We lived in Gardere.
Mm-hmm. Yes.
But just everywhere, and so just seeing what my mama went through. And then my mom also was, when I was a freshman in high school, my mom was a freshman in college.
Yes.
With 4 boys. So
Wow.
she pushed the standard. So I figured, hey, my mama could do it, I could do it.
There you go.
And so I went to Southern, went to school for social work, and I've just been serving people ever since.
You mentioned about your legislation for mental health in the
prison?
In the prison.
Okay.
And I'm trying to think here of Chico Yancey was in here yesterday, and I tell you, this would have been a real podcast if he had been in here today, because he was on fire yesterday, because that's his passion. Talk about that legislation and what it did for the prisoners.
I actually worked with Vote on that piece of legislation, and what it was, people don't realize that folks don't leave prison the way they went in. You know, sometimes folks are rehab, sometimes people aren't. You know, a lot of people suffer from PTSD, and instead of, you know, you getting discharged with a bag of pills, with the legislation that we created, you know, you have to have some kind of discharge planning. They're not just putting you back in the community, they're connecting you to resources. And that's the whole problem, that, you know, you don't know what the trauma that folks deal with, you know, when they go to prison. And so those are the kind of legislation. That's what we did like maybe 3 years ago.
Wow. And so, and even he talked about the voting, how folk need to know, just because you've been charged with something doesn't mean that you can't vote. You know, you haven't been convicted. And so it was great. And that population is a vulnerable population that really need to be served, and need folk like you in that legislature there. But it is it's definitely a need there. And then when you talk about all of the other things that you do that's centered around mental health, that which parents and the children in the school, tell everybody about that piece of legislation.
Yeah, no problem. A lot of people didn't realize that, you know, parents have to opt out of vision screenings and hearing screenings. You know, when you go to school, you have to opt out of that. They have option for dyslexia screening for parents, but they never had an option for mental health screening. And I think, you know, when teachers can bring those issues to their parents, or the parents can bring issues to teachers and principals, the schools should be able to give them resources.
Wow.
Now, it was an issue because of the money situation. You know, if these some of these, I guess, school districts didn't have the money, or they didn't have the bandwidth, or they didn't have those licensed professionals that could do those tests. So what they'll do is you have a list of tests that LDH will provide the schools of somebody that can give you those testing. So they can go to another testing site. Every district in Louisiana has a human service district, and so that's a huge resource where you can go get your kid testing. So now if a parent asks for that, if they can't provide it, they have to connect them with a resource to provide that mental health screening tool.
Wow, and the earlier the better. And you just don't know, screen them and, you know, and then provide that service. And it just may be just a little switch there that needs to be turned on to help our children get on up the road. And then the earlier the better is definitely.
And I tell people all the time. So I was fortunate enough. My mom sacrificed a lot. We went to U-High from kindergarten to 12th grade.
Yes.
Like I said, I just said I grew up and lived in every neighborhood in Baton Rouge.
Yes.
You know, looking at my cousins, my friends from my neighborhood versus my friends from my school. My friends in my school, they got diagnosed. You know, they got treatment, they got counseling.
Yes.
They got medicated. The folks that live next to me, they got labeled truancy, jail, bad. And so, you know, just seeing what's going on both sides of the track, I'm like, I saw the disconnect. And so as I got older and went to school, I'm like, these kids doing the same thing.
Same thing.
The kids I went to school and the kids I lived in the neighborhood, we're doing the exact same thing, but they have resources. So we're not making these resources available to parents, and we are part of the problem. So that's why I fight for what I do, because I've seen it, I lived it. I have family that suffers from mental health, issues. And so we would, things that we see as we get older, we thought it was normal, but it's not.
That's right.
And we're not catching it early enough, and it could have been treated. And so that's why I really advocate for it. I just think that, if you don't know, you don't know.
You don't know.
So I think if we can catch it early and we can treat it, and we can keep kids in school, we can keep kids out of prison. We can keep kids from dying, because a lot of times the mental health issues, it causes distractions. And I think, that's the stuff that we got to just continue to advocate for.
Wow. That all that you just said right there could be a book, man. Could be, yeah, that analogy that you made, of those that you went to school with and those really that you were playing with. Same thing, but different labels. That's the title of it. Same but different. Yeah, same thing but different labels
Diagnosed
there.
and got labeled.
Yes, that's it. That's it. And so that is definitely a need. And back in the day, the guidance counselors used to be that hub where the children received all of that. But then more responsibilities were placed on them, and that meant that mental health piece was removed from there. That individualized plan for each child was removed. And so here we are. So we're grateful that you've picked that torch up and ran with it and put that in place in order to make it real for our children. And that is of utmost importance. And so, so everything centered around mental health or getting a fella to the next level is what you represent, really. And I know that that'll definitely be something that you're going to continue to represent. So is there anything in the near future? I know you all go back into session on Thursday, the 23rd of October. And so when you go back then, or when you go back later, then what are some of the concerns, some of the things that you want to get your colleagues to kind of embrace as you see that that's a need in our communities?
Next session, because this is a special
session.
So we don't get focused on what the call is, and that's, the congressional maps or even the dates of the voting.
See, you need to repeat that, because this is educating.
Yeah.
Tell them what that special session is, and tell them yes, I know they're listening and they got to get this.
Oh, yeah. So you only can have bills related to the call. So the call that was made is for pushing the vote in congressional districts, the Senate districts, the state Senate, not our Senate district.
Okay.
But and pushing those dates, changing those dates around to make the qualifying different. We're gonna wait on what the Supreme Court renders, and it probably take another 9 months for that. But I guess the governor, they want to be proactive.
Yes.
In what they hope they get, and we hope they don't get.
That's right. That's right.
But the next session, I do want to continue to focus on mental health. I think Louisiana as a whole, and I always advocate that we treat substance abuse and we treat mental health counseling like physical medicine. We can't. It's not an arm break. We can't just treat them and treat them. You want to treat somebody for 2 months, a month, and all of a sudden now they don't have substance abuse issues, and that's not how this works.
Yes.
So we need a long-term plan. We actually, the state had a federal lawsuit where they were keeping folks with mental health issues in regular jail, and they weren't supposed to house them there. So now they're looking for places to house, these forensic psych, folks. And so they have a lot of stuff going on outside of that too. So we just continue to advocate for mental health, and I think we can change a lot.
Definitely can.
With that.
And with your passion, passion and putting things in place, and then when you can get your colleagues to internalize and visualize that which you see and that which that will be monumental. In my walk this morning, I saw several of the homeless individuals lying down on that concrete, and it's downtown. Right. So no one can tell me that mental illness is not there, because anybody without mental illness definitely would not sleep out all night, would not be up, just roaming. So there has to be some mental illness prevalent with that population, with that homeless population. And so that is something that is definitely near and dear to my heart, and that is that homeless population. So I'm glad you said that they're looking for the facilities, the forensic facilities, to really house these people and then have an individualized plan where they can be successful. And when we talk about success, you know, everybody's success is not the same.
Absolutely.
And so with all of that being said, it's got to be a plan in place, and you've got to work the plan for the people, and you got to be in it and to really internalize the plan for the people in order that they can just get to another level and then success, because that's the bottom line with all of that. And I'm a firm believer, when you sow into the lives of others, goodness got to come back to you or yours.
Absolutely.
Every time.
When I first came to the legislature, I was the only social worker there. And now we have some social workers, some psychiatrists. And I think this is probably the most bipartisan thing that we can focus on, because mental health doesn't have a party, doesn't have a color. You know, it don't matter if you're rich or poor. You know, it's something that everybody can relate to, but it does affect everybody around us. You know, if we can deal with this, I'm sure that we'll get people out of jail.
Yes, indeed.
I'm sure we'll get people, you know, because I know a lot of folks with mental health issues that know how to treat it. You know, they're properly medicated. They're seeing, you know, psychiatrists, they're seeing counselors, and they're going to work every day, and you wouldn't even know it. But it's the folks that's going undiagnosed that we feel like they have the biggest problem.
Yes.
Because nobody's working with them. Nobody's taught them how to cope. You know, nobody taught them how to deal with stress, anxiety. So that's why I'm just like, hey, we deal with this early, because I've seen it. I have real successful friends that was treated early in life, and now they're success stories.
Yes.
You know, I see it.
Yes, yes. And so that is what I refer to as the equalizer. As you say, it doesn't have any color or any, I don't care how much money you got or don't have or whatever. And so, and the other thing is, when you are that young population, you find yourself, if you really want to be effective, you got to treat that whole family.
Yeah. That's right.
That entire family. And so as they grow together and know together, then they're going to be better together.
Absolutely.
And so it's definitely important that there's an arm there to address the needs of the children's parents, guardians, or whosoever it is that they're living with. Because some of the stuff that these young people are actually witnessing and dealing with, we as adults, we wouldn't even be able to even handle it, you know, and so that family focus is definitely something.
Absolutely, because you know, if your parents have a mental health issue, even if you don't, you're gonna think mental health, those issues are normal. So you're gonna think that behavior is normal.
Yes.
So if you're not treating the parents, you know, and they're like, oh, this is not how my mama or my dad is supposed to act.
Yes.
They don't know any better. That's all, you know,
it.
it's nature versus nurture. I was taught to act like this. And not knowing you following somebody with a mental health issue.
Yes.
And you just repeating the same cycle. You know, so that's why it's important to you know, for me to at least advocate for it and do my best and that I can to put it out there.
And I often tell people the children are 2 years old, the mom 3 years old, grandma 4 years old. So, you know, we've got to teach the entire family, and they are appreciative. When you have a relationship and build that relationship with that family, they are appreciative, and they get to a point of asking themselves, where has this been all my life? You know,
absolutely.
where has this been all of our lives? And so, yes, yes, indeed.
Earlier this year, we had I had a piece of legislation. We had one hospital in Louisiana, women's hospital. Women's hospital. They started a wing for women dealing with postpartum depression.
Wow.
And it's up to a year. And what the issue was, the insurance companies wasn't reimbursing them. But they wasn't doing it for the money. But eventually, like, hey, if we're gonna do this service, we need to get paid, and they were getting denied. So we ended up passing legislation. So now, it was my piece of legislation. So now they can go to that hospital, and the stay is probably maybe average 7 days to 14 days, but they got up to like a year, whatever they need, because a lot of times people don't realize how depressed and stressed these mothers are, when they have these kids.
Yes.
And so hopefully there's a trickle down effect, and we can spread this, statewide, and that is the plan that we have, because we're so reactive and not proactive.
That's
right?
it. In a lot of
and so a lot of times they wasn't, like, even with suicidal ideations, you have to actually have a plan written down, or have tried to harm yourself before they can even treat you. And so those are the kind of things we're fighting for. Let's get proactive, Louisiana. Let's not wait till somebody try to kill themselves or hurt somebody. If they're telling us they're gonna do it, or we see the symptoms, we should start treating it. But a lot of insurance companies don't pay for it unless you actually have a plan. Or you can't get PC unless you actually try it. And so I've been working with doctors as well to help, change that legislation too.
Wow. And it's amazing. You the state senator, your wife, the doctor, and so when so I can imagine you all's conversations that you have, and how one feeds into the other one in order to help the population. And so listeners out there, education is the key. And see, you all have learned some stuff today that's going to be very, very good for you, needed, and all of that, so that you can know, now I can go to the school and I can reach out to them, or I can go to wherever and reach out. There was a young lady, and I've got to follow up with this because someone just sent it to me this morning, and it was a TikTok, and I looked at it. I said, why would they send this to me? The young lady is from Baton Rouge, and she says that because her child is a runaway, she has reached out for help, and they are saying to her, it's kind of like, unless he does something, and the child is only 14, then they cannot send anybody out looking for him. But I'm gonna have to follow up with that particular thing, and then she showed a picture of what the child drew and was saying, and it just wasn't good. It's a mental health issues there. That this is an instant where this child needs some help. And so I'm going to definitely follow up with that in order that we can be able to see how we can help this mom. And I always tell you all about District 10, and I walk it, I ride it, I see it, and I know that over here in District 10, mental health services is definitely a need for children and adults. And so that's going to be something that we're going to keep our glasses on and look through and see just how, and even all mental health doesn't look the same, does it?
At all.
Not at all. That's the thing there. Everybody is looking for folk to be buck-eyed and I know some chill folk that need some mental health. So we got to make sure that the stigma that yes. So
a lot of people think they can whip it out of a kid, and that don't help all the time.
It does not, because you bring up a whipper, he's gonna be whipping, and and then that cycle will go on. Right. And so it's very important that we know what to do, how to do, and when to do. And so, anything else you want to tell this great listening audience here in Baton Rouge, the best city there is?
I appreciate you inviting me here, and I just wanted to follow with, we have to be proactive with helping parents. When parents asking for help, and now, hey, my kid is displaying these kind of behaviors, and like I say, you got to wait till they actually do something. If you don't catch them now, they are going to do something.
Yes.
And so now you want to wait till they do something and lock them up.
That's it.
Or put them somewhere, and we could have, saved all that.
Yes.
And we have to be proactive, and I think there's a lot of stuff that we do. Just Louisiana as a whole. We're just kind of really getting on telehealth until the COVID.
That's it. That's it.
we have-
And
we have-
now telehealth is telehealth. And you hear
we
me?
and think about all these rural areas in Louisiana, we don't have access to care, and we're just starting to do it.
Yes.
So I just think that we got to continue to do the work and continue to fight.
Yes, yes.
Continue to advocate, and I think we'll be fine.
There you go. That's the big word, advocate. And so you all heard it from the number one best senator in District 14, the Honorable Larry Selders. And so want to thank you for joining me today and to get out the information to our people in Baton Rouge, and want to avail this podcast opportunity to you at any time that you feel that there's just something you need to get on out. Know that the door's here, always open to you. The thing I like, and I really, no, it's not a like, the thing I love is that I am the councilwoman at the bottom and I go up. And so I'm the councilwoman. I have a state legislator, and then I have my senator, and then I have my congressman, and we all do what's best for our areas and other areas as well, and have a great relationship. State Representative Terry Landry has been on here, congressmen have been on here, and now my senator. So I'm telling you, I just feel like I'm doing something here, and this will not just be the only time, not at all, but at any time that there's information that we need to get out here, and we can seat more than two, yes. And so just want to thank you for joining us, and as we close, want to remind you out there to share, to subscribe, to like, comment to the channel, because when we know what we know and hear from you, then we can grow. But I want you to remember, Coleman cares.
Count on Coleman. Count on Coleman. If your world is looking strange, you can count on Coleman for change.